All right, what is your name?
Autumn Walls.
And what is your major?
I'm a nursing student, first semester.
All right, and then what is the object you're going to be showing me today?
I'll be showing you my blood pressure cuff that I was supposed to get this semester. It's basically just a device that's able to test your blood pressure manually.
All right, and what do you like about the object?
What do I like? I mean, it's pretty easy to use. When do you go over the parts?
No, you can just show us now if you want.
Right now?
Yeah, if you want.
Okay, well, I mean, it's so easy. It's called a sphygmometer, but no one uses that big of a medical term right now. So it's literally just this, like, cuff, which you put around someone's, like, upper arm right here. And you can do either arm, it really doesn't matter, but they just have to be sitting up straight with their feet flat on the ground to test it. And you just basically put it on, and then you put the gauge, like, onto the cuff, and then you'll use this inflation device, doesn't really matter what it's called, and it has this little, like, rotator on here, and it's just to have the air, like, flow out, or you can, like, when you pump it all up, you can have it, like, stay in there, which actually inflates the cuff. And then you need your stethoscope too, and then you just are able to listen to, like, your systolic and your diastolic blood pressure, which systolic's just the first number and diastolic's the bottom number, and systolic is like the first heart sound you hear when you're deflating the cuff, and diastolic's the last.
All right, and pretty
simple.
Yeah. How long have you had this object?
Let's think. What is it? October? So only like 2 months. We had to get it when you get into the actual nursing program, because, like, freshman, sophomore year is just pre-licensure, taking like science courses or and like whatnot, and then once you actually get into the program, you need one of these, because I don't know if in clinicals if I'll use it, but for skills, when you actually, like, learn hands-on things, like, I need this.
Do you like those classes? Do you like working hands-on?
Yeah, I would say, because, like, I have a skills, it's one class, it's like nursing 336, and it's skills and assessment combined, and I basically think of it as 2 separate courses, because assessment is when I'm actually, like first week was skin, so it's like going up to your patient, like if they're, like, laying in the hospital bed, and assessing skin and, like, just, like, any, like, lesions on their body, redness, or any abnormalities you're looking for, literally from, like, head to toe. 1 week's, like, musculoskeleton, one's respiratory, one's cardiac, so it's literally just, like, hands-on, doing an actual assessment. And then skills is, like, my 4-hour lab that I have on Thursdays, and that's, like, in person. Well, they're all in person. But skills is, like, let's think, what have we done so far? Wound care test outs, like, I'm on, like, an actual mannequin, and, like, they have, like a deep wound that's, like, obviously fake, and it's, like, packaging the wound. And then, like, 1 week we're doing IVs coming up. We just had our administration test out, so, like, I was, like, pretending to give, like, oral meds and a syringe of insulin into a patient, but it's, like, fake little, like, skin we use. But yeah, that class is fun. It's just the hardest, because you have to have an 80% up or you don't pass the program if you can't move on.
Wow, okay.
Yeah, they're a little strict.
How often do you use this in, like, your classes?
Well, I guess I said I used it earlier for skills, but that's a lie. I use it for assessment, so my bad. But, I mean, we only learned, week 1 was, like, learning how to do blood pressure and, like, vitals, so literally.
Was that easy for you?
Yeah, like, we learned it in, like, a week. The first week, our instructor, like, taught it to us, how to do, like, the steps and everything, and then, I think, what was it, maybe week 4, we had, like, our blood pressure, like, vitals test out, so, like, I had to just, like, be with another nursing student and, like, just record their blood pressure, and then my instructor would have a dual stethoscope, so it's basically, like, let me just pull out mine. Let's see. So this is just, like, a normal one. This is just, like, a Littman nice stethoscope, but a dual one, like, instead of just having, like, one of these, like, it'll, like, branch off into, like, 2. So, like,
okay.
He listened at the same time I was, so, like, when we're listening on the gauge for, like, the actual blood pressure readings, like, it has to match up exactly with his. Like, you could only be within, like, 2 milligrams or millimeters away from, like, his range.
All right. Do you use these 2 objects together a lot?
I mean, yeah, like when you're taking blood pressure manually, which doesn't even happen that much anymore, a lot of places just have it electronically, but when you are doing it manually, like you have to have a stethoscope because you have to hear for the heart sound, so
Yeah.
they need to be used together.
What made you get into nursing?
To be honest, I never like even thought about doing nursing in high school. Basically, like when you come to Mankato for the nursing program, like they're on a 4-year like track you have to follow, and it like interested me in the start because I always like science courses and all that. So I basically just like went into it for the start and like just like threw myself into it, and like I've made it this far and I'm in the program, so here we are today.
Do you prefer using like these two objects together or separate?
Like together, because you kind of have to use them together.
Yeah.
Like I said, yeah. You can't really take blood pressure without a stethoscope.
Gotcha.
Unless you are doing it electronically.
Yeah.
Which you can just, I mean, I haven't been into clinical yet where you like use it electronically because I haven't been into like a main hospital. I've only been to an assisted living care so far, but for like our simulation labs on campus where like you're literally in like a hospital room in the clinical science building, what do you call it? They have like a whole mannequin that like breathes, blinks, speaks, and everything, and like you literally go in there, like you get assigned different roles. Like 2 girls go in like as a nurse, 1 person might go in as like a family member, and like the roles of the nurse, like you literally have to go in there and like take vitals. But they have like a giant screen monitor on like the right side of the bed, and you can literally just tap the screen and it'll record like blood pressure, pulses, and like all that, which is so much easier.
Yeah. Where do you keep these objects? Where do you keep your blood pressure kit?
Always in my clinical bag that I got literally just off Amazon, but it's so nice because Mankato gives you this little one. Should I show that?
Yeah.
Okay.
You can bring it out.
Over to grab that. I literally can't. They give you this gorgeous bag. What am I gonna do with this? I don't really know. It definitely does not carry all 15 textbooks I had to buy for this semester, but
Where are your textbooks?
that's the double. Oh gosh, let's start over here. So, goodness gracious. Okay. Here's a bunch. 4 classes, books, flashcards, code of ethics books. Literally everything you could think of is right here.
Have you read all of them?
No. No, half of these I like haven't even touched because as a nursing student, on top of having quizzes every single week and then having exams basically like every other like 3 weeks, you don't have time to sit there and go through, like, my teachers assign, like, I mean, obviously the reading's important. It's important to understand the knowledge as a nurse. Like, you can't, like, fake it through this program. Like, you actually have to, like, apply, which makes sense. You're going to be, like, saving people's lives, basically. But sometimes you just don't have time to go through, like, over 300 pages a week of like 10 chapters. Like, it just doesn't happen. So you prioritize the more important things.
Yeah. Which textbook have you used the most so far?
Oh boy. I would say this one. This is my medical terminology book because we have quizzes every week in this in my skills lab, and this one's just the most fun. Like, it's literally just learning how to like defer words and like just understand like what like certain meanings are, but that one's the most interesting. I like that one a lot.
Which ones haven't you read or touched? Or
Okay, I haven't touched fundamentals of nursing. This is for like, because on Mondays I have 2 classes that's like a family nursing class and a professional nursing class, which are like, they're still important classes, but they're definitely the easiest. But our teachers know that like there's other classes you need to prioritize more, obviously, and so the readings for like those 2 classes, like I barely ever do, which includes this book. I don't know if I've ever opened this book. This one, and then I mean that's probably it. I also like bought this too, and then they like literally of course had to send out an email like a week into school saying like that they had like a link to it online, and I was like, okay, cool. Wasted money on that one, but it's lovely.
Okay, so going back to your object,
Can I just like,
yeah,
I'll
you
just, like,
can
slide
put
these
those
away.
away.
It's ginormous. I'll slide these away. Okay, you can start asking me.
Going back to your object, do you think that you will probably keep this object for the rest of your life, or
I mean,
do you think you'll get rid of it at some point?
I mean, my stethoscope, I'll never get rid of, because Littmans are like, this is like $100-something stethoscope. Like, these are like super nice, and the only reason I would ever get a new one is if this was stolen, which I won't let that happen. But my blood pressure cuff, I mean, blood pressure cuffs are fairly cheap. You can get these, I literally got this off Amazon for like, I don't even want to say $20. So again, I probably won't ever really need this, because most places will have like electronical blood pressure recordings that they literally just put on you and press a button. So I mean, I probably will keep it then, since I like never will be using it. It'll just be nice to like have on hand in case there's ever like a power outage or blackout
Yeah.
in the hospital. Like, I'll whip this out.
Do you think that object's pretty valuable to your education as a nurse?
Oh, yeah, for sure. I mean, like, blood pressure is so important, like, because, like, if your blood pressure's out of range, like, that can, like, tell so many different things, like hypertension, which you don't want. Like, you want, obviously, normal blood pressure reading, so I would say it's pretty vital.
All right, thank you.